Good morning, everyone. Thank you for all joining us today on this special occasion of Rare Disease Day. My name is Dr. Priyanka Vadhva, and I'm truly honored to host this session with you today. Rare Disease Day is an important reminder that those who suffer from rare conditions often face a long journey, both in terms of diagnosis and treatment. Today, we are focusing on spreading awareness about rare diseases and shining a light on the importance of early diagnosis, treatment options, and research. At Ikris, we are committed to improving the lives of those affected by rare diseases. Our mission is not only to support and raise awareness, but also to build a community that believes in the power of knowledge, support, and advocacy. The rare disease community is vast, yet we are often overlooked. But with the initiatives like Rare Disease Day, we have an opportunity to change this narrative and bridge the gap of awareness and care. Today, I'm excited to be joined by Dr. R.K. Jain, a pediatric neurologist. Dr. Rakesh Jain is a UK trained and experienced pediatric neurologist with over 20 years of experience. He has been working as senior consultant pediatric neurologist at Fortis Hospital, Gurugram, for the last 19 years. He has presented his work at many conferences like Pedicon, European Pediatric Neurology, British Pediatric Neurology, and the Royal College of Pediatric and Child Health Conference, to name a few. He has been at the forefront of treating rare neurological conditions, and many of his patients suffer from conditions like Duchenne muscular dystrophy, spinal muscular dystrophy, epilepsy, and many. He brings with him a wealth of knowledge and experience. And today we'll be discussing the challenges faced by those living with rare diseases, particularly DMD in India. And before we begin the Q&A session, I'd like to take a moment to acknowledge that while rare diseases affect a small percentage of the population, the impact on families and communities is profound. It's our collective responsibility to raise awareness and bridge the gaps in care, research, and resources for these diseases. Now, let's get started with our session. And thank you once again for joining us. And thank you, Dr. R.K. Jain, for being here today. So, to start with, could you please give us an overview of what constitutes a rare disease? How is it diagnosed? And what are some of the common challenges patients and families face when it comes to rare disease diagnosis? Over to you, sir.
Thanks, Priyanka, for inviting me. First of all, it's a great initiative to create awareness about rare disease because, I did my MBBS in 92. So I'm 92 batch. So how many years been passed? Nearly 30 years, right? More than that, more than 30 years, right? So at that time, when were we doing our, MBBS, at that time, these rare diseases, we just used to read them in the books, textbooks, and we used to say, okay, they are for exam purposes only. You just have to know it, but we can't treat it. We can't even probably diagnose them, but we just have to know. If examiner asks the questions, you should be able to answer. So from that era, I mean, from 3 decades ago, I'm talking about, now we are in an era where we can, clinically diagnose these conditions, and we can have a specific test, whether it is metabolic test, genetic test, and within the genetic there are different type of genes, I mean, that we can identify. Then there are targeted therapies available. I mean, it's a whole, I mean, I would say a lot of world to, travel through. I mean, we don't know the exact how much, rare diseases are, but the kind of journey that people have started in the last decade, I have seen the changes in India. Now we are able to diagnose few disease, and as I said, targeted therapies are available. What are the challenges? I mean, as the name suggests itself, we don't have enough expertise. As a pediatric neurologist, I get to see, I mean, few cases of a particular condition every year. But if I talk about the general physician who are sitting in the community, general pediatricians, I mean, who used to see all the normal, conditions, it is very difficult for the limited time frame in the, a lot of resources constraints to be able to think clinically that this could be the diagnosis, and how could we pinpoint the diagnosis, and let alone the treatment part of it. So it's huge challenges. A country like India, we are resource limited, and expertise are also not available. I mean, I could go long, on this topic, but even the training part, if we see, I mean, 1 decade ago there were no training. Even DM in pediatric neurology has been started, I think, 12, 13 years ago. First DM was started in AIMS. Even now, there are not much, trained pediatric neurologists. Most of the people who are practicing pediatric neurology got some experiences abroad, but in India, still the seats are limited. So there are huge challenges. But it's a collective job of everybody. I mean, there are lots of, I know the parents who are pulling this cart actually, along, and they're just getting government together, they're getting us together, and the doctors and the, certain NGOs. So everybody is putting a lot of efforts, and I'm glad that, we are talking about those rare diseases, and let's see if we can make sense for few kids, if we can make, difference in their lives. That would be a very good achievement.
Yeah, very true. And also, I would like to know that you see a lot of patients with Duchenne muscular dystrophy. Could you explain what DMD is and why it is particularly concerning in pediatric neurology?
See, Duchenne muscular dystrophy, although it comes under the category of rare disease, but it's not that rare. As we have learned more about it, and we have seen more patients for DMD, in short, we call it, and it's a spectrum. It's DMD or it's Baker's, and there are other muscular dystrophies which we come to know after getting the proper genetic diagnosis. Sometimes they look like DMD, but they are not DMD. They are some other, dextroglycanopathies who could mimic this thing, and the treatment part varies. So, what is DMD? DMD, if in a very layman language, I will try to make people understand. There is a dystrophin gene that kind of creates the building block for the muscles. Okay, and if that dystrophin gene is missing, that muscle protein is difficult to be made. And if that muscle protein is not made, we cannot have that muscle bulk. Okay, and as the child grows, that muscle bulk, it's a kind of degenerative condition. The disease grows with time, and as the time pass on, that muscle bulk, the muscle fiber, they get replaced by fat. So we call it pseudo hypertrophy. In many of those kids who have Duchenne muscular dystrophy, if you catch them at the age of 4 5 years, you will see the calf muscles are rather, they're looking bulky. And if you try to feel them, obviously it is bulkier than the normal people, children of that age. And the feeling is also different. I mean, you need to have, examined few muscles to be able to differentiate that, this is a pseudo hypertrophy or this is a proper muscle. So that's how, I mean, it's easy nowadays to diagnose, and it's not very expensive. The dystrophin gene test is available in pretty much every lab. So it can be ordered anywhere. If you suspect DMD, you must look for the dystrophin gene, any deletion, duplication, or maybe we can do sequencing. There are different type of tests, and we can come to the diagnosis. And once we diagnose them, then yes, the journey starts.
I see. And if I talk about like how common is DMD in India, especially in your practice, like how many patients do you see, in an average, if I talk about in a month or maybe in a year?
In a year, I would say in Duchenne muscular dystrophy, whether we catch them as a first timer, sometimes, although as a pediatric neurologist, I should not see a first time patient, but patient do come sometimes. The child is not walking properly, there is some limping, or he is 1.5 year old, 2 years old, he has not started walking. And then obviously we go through history and everything. Then we make the diagnosis. So we get the patient directly from community. Then we get some referrals that child is not doing this, what it could be. And thirdly, we also get the referred patient, like, this child has been diagnosed, but now pediatrician says, all right, why don't you go to a specialist? They can give some better advice in case there is some new therapy coming in, which is fair enough. So in a year, I would say, putting together, I would see approximately, a dozen of patients of Duchenne muscular dystrophy. Including in Fortis, my clinic, in my peripheral OPDs, like I do OPD in Rohtak, Sonipat, and earlier I used to do in Ranchi as well. So collectively, if I say approximately 10, 12 patients a year, I get to see of DMD.
And if we talk about awareness, like what can we do to increase awareness about such diseases like DMD in India? Like if I talk about some practical steps that healthcare providers or communities or maybe advocacy groups that can take to make a real difference?
See, basically, I mean, in India, we don't have any universal program for development screening. In UK, where I have practiced for about 11 years, there was very good community program in place. The community worker will come to your house and they will just see the milestones. At 9 months, your child is doing this. At 1 year, the child is standing, started walking, saying few words. At 1.5 years, children are walking, there's no problem. So if at that point, so that basic milestone knowledge they do have. And nowadays, I mean, the new young parents, they also have those knowledge. So if you see, I'm talking particularly about DMD, not other things. There are so many things otherwise. So if a child of 1.5 year old, if he doesn't start walking, then I mean a ring should, I mean, there should be some suspicion that what's wrong with my child. It may be nothing. He may start walking after a month or two. But 1.5 years is a kind of milestones. We take it very seriously. If child is not walking, you should go to your doctor and think about it. So if that sort of program is there in our system, then probably we won't miss it. And DMD is one of the common, I would say, muscular dystrophy, which can be caught actually at 1.5 years, 2 years, and we go along. Then obviously the signs of DMD become more obvious and it's easier to get. But the point is, if we can get it early, we can kind of slow down or stop the progression depending upon what the kind of pharmacotherapies we are talking about.
Right. And for parents and families who are affected by DMD or any rare diseases, what advice would you give them regarding available treatments, support systems, and how they can navigate the healthcare system in India?
See, first of all, I mean, in India, we practice very diversified system where there is allopathy, homeopathy, Ayurvedi, Unani, and then there are all lots sort of mystic treatment, some babas and all that. So everything exists here. So first of all, my very sincere advice is get the diagnosis confirmed. Let's say it is confirmed by one lab. I'll say because it is a kind of it's a it's a big thing for any family to be labeled as the child is DMD. I would say get it confirmed with another lab. There are lots of labs nowadays, and it's not expensive test. So once we have complete confirmation by two labs saying similar things, then my humble request to all the parents is they must accept it. Because if you don't accept, you will keep moving from pillar to post. In a hope that somebody will say, okay, मैं आपके बच्चे को ठीक कर दूंगा. But that's not the case. There is no treatment existing as of now that I can just push one injection and I can completely reverse the changes what has happened. So acceptance is must, and there is a lot of literature available nowadays. If your child has a suspicion of DMD or confirmation of DMD, even if you put Google, you might have some misleading information, but if you spend a day or two, you will find, I mean, decent knowledge. Then you can go to your nearest pediatric neurologist who can take you through the journey. So that's the first thing, acceptance. Then DMD doesn't come along. It does have other problems as well. Like, we must make sure that heart is fine. So if I have a patient of DMD in first time, I want to make sure that, the echo is fine. There's no problem with the heart. I would check the lung functions. I will get the basic pulmonary test done because it can take toll on the lungs as well. If the child grow along, your breathing muscles get involved and it can cause, other type of troubles. Then I would like to see the spine is straight, your vitamin D level, calcium level, they're all fine. So generally we recommend a surveillance of at least on yearly basis if everything is going smooth. If there is a problem in any area, then obviously, depending upon the problem, we address it accordingly, how frequently we have to call the family and what intervention we need to do.
Right. So, which means there should be a kind of holistic approach to such kind of, like in managing such kind of diseases. And especially, not
Absolutely.
only single specialty is going to work, it needs a multi specialty care. And
Hmm.
right. So, but I think, there's a lot to do in the awareness area because patients are also not aware that, patients' families, that whom to approach, what to do. They are running from here to, to here, and they're from running from doctor to the doctor like that. So I think they should also have one stop shop or one stop platform where a DMD patient should get a standard of care or some kind of multidisciplinary treatment under one roof.
I agree, 100% agree. As I said, there are a lot of information available, and most of the pediatric neurologists, if you visit them, DMD is fairly common disease for us actually, because we do see a lot of patients and there is a lot of expertise around it. Because this is not a new problem; it has been around for ages. I mean, I have been hearing about DMD as my as a trainee and then as a consultant for last 30, 40 years. So it's not new. So expertise is definitely there, and people are fairly up to date about it. I mean, what's going on, what the research is saying, what treatment is working, what is not working. So if we but obviously you need to have some hand holding as far as awareness is concerned about it. Maybe what we are doing is the right thing. I mean, social media, newspaper, and obviously there are a lot of groups. Parents can join those groups to get the update and to get some sort of hand holding. Sometimes it is difficult to accept, and when you accept it you don't know the trajectory. But if you have seen somebody who can take you through their own journey, then you believe it better rather than reading a book and then trusting that phrases. So
Correct.
that's the kind of thing available nowadays, and I think parents should and take that initiative or take some efforts or go to the professionals, and it would definitely help.
Right. And if I talk about current available treatment that we have been reading, like, gene therapy is there and, some exon skipping therapies are there. So what do you have, to say, or what would you like to comment over it? Like how much they're helpful? Do you think they really, I mean, if we actually put our patient on such treatments, what can be the expectations, or what can be the prognosis of the case?
Yeah, it is different. See, I mean, all these therapies they have been coming. I've been reading about the last 1 decade. There are few treatment like exon skipping, exon disc by the name. Now, latest this Vonrolon has come up. Earlier, we even now we are using steroid. But none of this disease completely changes the scenario. There is some help that we can get, but that's how the research evolve over a period of time. At one instance we cannot get any injection that I put the injection and I can change completely. That's not possible. So research is also evolving. So we are getting some relief now, although most of the diseases, the drugs they are available. Many of them they are not available commercially, and none of them is available commercially in India as it is. But yes, on a per patient basis we can import those medicine from the country of origin like US or Europe, from wherever it is. And the treatment is expensive at the moment, so people have been using different kind of resources, crowdfunding, to get those medicines. But as far as impact is concerned, yes, there is some relief. There are a lot of data, but we have not done the vertical study so far, like from birth up to the let's say 50 years, 60 years study. So we don't have that much of data to tell completely that okay, I have started the X medicine at 2 years of age and the child is absolutely fine until this. So we don't have that. But yes, we have like 5 years trial and all that. So those drugs they have made the difference in 5 years times or even earlier time. And there are different criterias that in research, we see the walking distance, the child is able to stand for how long, the spine is straight. So there are different criterias. I mean, on the public platform probably people may not understand those. But yes, these medicines they are helping. But can we get complete cure from the disease by existing medication? Probably we need to see the data. I mean, still it is premature to say that.
Well, I totally agree with that. And since there are a lot of drugs which are getting FDA approval, but as you mentioned, that we do not have that vertical data for over the, like for the decades. So I think since we have already few drugs available from the FDA, I think in coming decades we might be in a position to have some kind of, data which have been like which will be, I'm sure, will be fruitful for the physicians, of course. And if I talk about the resources for rare diseases, especially in India, how do you think we can improve the infrastructure for early diagnosis and continuous care for rare disease patients, keeping the rural population in mind? Is there any hope on the horizon for the
See,
resources
certainly there
facilities?
are lots of, as I said earlier, awareness is the key. And most of these medicines, they are being researched abroad and they are very expensive because of their patent issues. Importing them to India is a nightmare. But again, if we have more awareness, we have more diagnosis, we have more numbers, maybe we can negotiate with the company to get the medicine cheaper. We can get help of the government to waive off some taxation, some import duties, to get them to the last mile. And the most important thing nowadays, that Make in India program, that the way India is progressing. See, the ultimate the joy of the treatment would come when we have own research here. When India will do the research, will do the intervention, we will come up with our own medicine, then it will be cheaper and it will be available to the masses, as we did in the COVID vaccine case. So it was available for every Tom, Dick and Harry. There is no differentiation on economic basis. So that is the best case scenario if we can have. Until then, awareness and the numbers, so that we can negotiate with those companies.
Absolutely. Very well said. And my last question will be looking to the future. What advancements do you foresee in the treatment and management of TMD? One, you have already mentioned that, Make in India program. But other than this, how would you foresee the advancements and how can families and communities prepare for these changes?
See, genetics has been coming in a big way. In diagnostic, I have seen in the last 1 decade. Uh, 15 years ago, I would say, I was not much aware about this, genome sequencing and all that. We were just, reading on the articles, but we are doing those, we are making those diagnoses. So in diagnostic, genetic has come up to a point. The only thing is we still need to get it cheaper and more cheaper, so that it is available to the masses. They are still a bit expensive. And the day is not far when we get genetics into therapeutics as well. So genetic intervention is not far, and particularly in our neurodisabilities, and rare diseases. So neurogenetics is going to play a big role. So there is no doubt about it, and we must actually, do intervention. We do the research and put some budget on it. So I can see, and there is not far. Maybe in a decade or so, you will start seeing that. What parents can do, how can they prepare themselves? Being aware and staying up to date. I would say wherever you are in any part of the world, get in touch with at least one pediatric neurologist. Maybe once a year, just for surveillance, just visit them. At least you will get to know what's going on, something new is coming. I don't know. There are different studies, different criterias. A child of 20 years old with DMD may or may not fit into it. But there are certain things that keep on coming. So we should never lose hope. So that's what I would say. Keep up to date, keep in touch with somebody, and research is going on in a very massive way all across the world.
Thank you so much. It was really interesting to know a doctor's, side, that what they have to say about the conditions the patients are facing. And thank you so much, Dr. Jain, for your valuable insights today. And it's clear that while there are many challenges in the rare disease space, there's also tremendous hope, and we are making progress. The role of early diagnosis, proper treatment, and increased awareness is crucial, and it's a privilege to have you with us to shed a light on these important issues. And to everyone watching, I want to thank you for your participation and helping us raise awareness for rare diseases. Your presence today is a vital part of changing the future for those affected by these conditions. And let's continue to educate ourselves and spread knowledge and support each other, especially those facing rare diseases like DMD. At Ikris, we are committed to continuing this work, and together we can bridge the gaps in awareness, healthcare, and create a more inclusive and supportive environment for people with rare diseases. Thank you once again for joining us today. Stay informed, stay compassionate, and let's continue working toward a world where rare diseases are no longer rare in awareness. Thank you so much, Doctor, and we wish you a very
Thanks, Priyanka. Thank you very much.
thank you so much, sir. Yeah.
Thanks. Bye bye.